Hi everyone, it's Dr. Cambo, and today I'm going to give you a tour of the CPT Professional Manual. When you're in the very early stages of learning the CPT code set, it is critical that you understand the structure and format of the manual. So first, I am on the outside cover of the manual. This is the official code set that is published and owned by the American Medical Association. CPT code set has been utilized since 1966. Let's begin with our tour. So first, I'm going to go to the inside cover. So I have my cover kind of folded in half because I want you to see two parts. Here, there are tabs that have been provided for you to organize your manual. I'm not going to show you those tabs in this particular video because there are some other YouTube videos out there that actually show you how to tab your book. What we want to focus on today is just getting acclimated to the manual. So here on the inside cover, on the upper left-hand side, the first thing that you're going to see are the symbols that are utilized with the CPT code set. These symbols appear first in the inside cover because these are symbols that you're going to see, and you need to know the significance of those symbols. So for our first symbol, we have a single triangle, which is the revised code. What this triangle says to you as the user is that for this edition of the CPT code set, the code that you are looking at was revised. Next is the bullet. The bullet or the closed circle next to a CPT code lets you know that that code is new for that current edition of the manual. The left and right facing triangles, those symbols are used to indicate that the text that you're looking at, again, in the version of the manual that you're looking at, that the text or the wording is either new or revised. Now let's pause for a second. These three symbols are very important in terms of providing you with information about a code that you're looking at. Now, when you look at that same code in next year's version of the manual, that symbol technically won't be in front of that code. It'll be in front of a different code that's either revised or new, or if any of the text has been updated, the left and right facing triangles will be listed there. Next, you have your reference to CPT Assistant, clinical examples in radiology, and CPT changes. These are additional references that you can obtain from the American Medical Association that help you understand some complex types of coding scenarios. The CPT Assistant is published on a regular basis. It's where coders and physicians and other individuals write in and ask the AMA about a particular code. CPT changes. This is actually letting you know that that particular code went through some changes for the year that's actually referenced in the CPT reference. All right, let's continue on. And guys, same thing with the clinical examples in radiology. As the name implies, those are examples specific to radiology. Next up, you have your add-on code. Add-on codes are used in conjunction with another code. That means if you are looking at a code that has a plus symbol in front of it, you should immediately know this code cannot be used alone. It has to be used in conjunction with a primary code. And we'll see some examples of all of these symbols as we go through the manual. All right, something else I want to tell you about the plus sign or the add-on code, and that is whenever you see an add-on code, you cannot add a modifier 51 to that particular code. Now, we're going to talk about modifiers in more detail in another segment, but just remember in the back of your mind, add-on codes cannot be used alone, must be used with the primary code, and I cannot add a modifier 51 to an add-on code. All right, next up is the circle with the line through it. It's also known as a null, N-U-L-L symbol. And this particular symbol is letting you know that a modifier 51 cannot be added to that code. Next up, you have the lightning bolt symbol. This is assigned to a code, or you'll see it next to a code that is pending FDA approval. Next up, the pound sign or the hashtag, and that's this symbol here. This is utilized when a code or codes that you're looking at are out of numerical sequence. And so what that means is instead of the code being in numerical order, you're going to find that that code is out of order from the standard, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, I know you're wondering, well, why is that? Well, from time to time, the AMA has to move a code over to a different code family because it's actually where that code belongs. And so I know you're thinking, well, why not create a new number? Well, it's no need to create a new number. There's nothing wrong with the number. It's just that that code needed to be moved over next to codes that reflect the same procedure or anatomic family. Next up, you have your star, and this is for telemedicine services. And this is in front of codes where that particular procedure or service could be used as telemedicine. And the last symbol, duplicate PLA test. That's proprietary laboratory analysis. This is letting you know that that's a duplicate test. All right, underneath there, still in the inside cover left side, you have modifiers. And notice it says, see Appendix A for the definitions of the modifiers. So this is just a list of the modifiers, but the actual description of the modifier is in Appendix A, which is in the back of your manual. So modifiers are added to a CPT code to demonstrate that the service that is being reported today has been modified in some shape, form, or fashion. Of note, for those of you who are familiar with ICD-10-CM or ICD-10-PCS, modifiers are not used with ICD-10-CM or ICD-10-PCS codes. So the modifiers here on the left side, and notice this is the left side of the page, inside cover, these modifiers are actually used when you are coding and billing for the provider or service that's being rendered. Now I want to jump over because I want you to see something. Notice it says here, modifiers approved for outpatient or hospital outpatient usage. This is for when you are coding and billing for the outpatient hospital as opposed to the provider. All right. There are modifiers for anesthesia services. I have another video segment that focuses on anesthesia, and you'll see those modifiers explained there. Then we have level 2 Hicks Picks modifiers. Now, you may or may not know that the CPT manual, the CPT code set, is a part of a nomenclature known as Hicks Picks, Healthcare Common Procedural Coding System. So CPT, which is the manual that we're talking about now, is level 1, and then Hicks Picks is level 2. Now I know you're thinking, well, what do you mean? Let me show you. So there is literally another code manual, yes, another code manual that is for Hicks Picks coding. So remember, CPT, and let's make sure everybody, you guys know I'm a visual learner. So CPT is level 1 of Hicks Picks, and then this is your level 2. We'll talk about level 2 in another video. All right, so back to what I was showing you here. So this is just a partial list of the codes that are in the Hicks Picks manual, okay? Just a partial list. All right, so after that, again, you have the tabs. I mentioned to you that I was not going to go over tabs. After that, and I am walking through the manual, guys. After that, you have what are known as place of service codes for professional claims. So on the CMS 1500 or the HIPAA 837 form, whatever form or version you know the name by, it's the form that's actually used for professional claims. This 2-digit number actually tells the payer where the services were rendered today. So for example, in this particular case here, let's say place of service 11, this means that the service was actually rendered in the office setting. All right, guys, so that's a billing concept, and since we're focusing on just getting used to the manual, we will keep on going. All right, so then after that, guys, you'll have, the title page of the CPT manual, so we'll skip through that. You'll see more information about CPT. Remember I told you CPT has been in existence since 1966, and this happens to be the 2019 version that I'm looking at. Then you have all of the folks that worked very hard on keeping the manual current and updated. And after that, you have your table of contents. Now, the table of contents is something that I recommend that all new users explore. Why? I think before you begin to use a manual, it's just important to know what's contained in the manual. So at the very beginning, you have your introduction. Now, if this is your first run at using the CPT manual, I highly recommend that you read the introduction to the manual, because it really just, in my opinion, lays the foundation for what's contained throughout the manual, as well as some things about the use of the manual and maintenance of the codes, and you'll get in more into add-on codes and modifiers, as well as the place of service numbers that I just mentioned a few minutes ago. So guys, must read. Then after that, you have your illustrated anatomical and procedural review. And here, guys, just a couple of diagrams or terminology that, at a minimum that you need to be familiar with when you're using the CPT code set. Now, from there, you get into the first main area that is utilized for coding. So first, let me pause and give you some information that I believe is going to set the stage for what we're going to talk about next. So the CPT manual itself is divided into 3 categories. And so right here, where the evaluation and management section begins, that's actually the beginning of category 1. Now, I know you're thinking, how did I know that there were 3 categories? Well, guys, remember I said read the introduction? Well, in the introduction, there is some information regarding category 1, 2, and 3. So category 1 is actually the main portion of the CPT code manual. Category 1 is subdivided into 6 sections. Each section begins with guidelines. So let's pause. First, let me show you the 6 sections. First, evaluation and management. That's section number 1 of category 1. Then you have anesthesia. So this is your second section of your CPT manual. From there, guys, you have your third section and your largest section, which is your surgery codes. From there, you have radiology. That's section number 4. And then, guys, after that, you have section 5, which is your pathology and laboratory. And then lastly, you have section 6, which is the medicine section. So let's pause to review. The CPT code set is divided into 3 categories. The category that appears first is category 1. It is the main portion of your CPT manual, and it consists of 6 sections: evaluation and management, anesthesia, surgery, which is the largest, radiology, pathology and laboratory, and then medicine. Those are your 6 sections of category 1. Next, what you'll want to know is that each of these 6 sections actually begins with guidelines. So many of you may be familiar with the other code sets, ICD-10, CM, ICD-10, PCS, and you may recall with those systems that the guidelines are contained in the front of the manual. CPT, guys, is a little different. First, your guidelines are in the front of every section. In the front of every section. But then, within each individual section, you have more guidelines, and those have a different name. So for now, let's focus on this. Category 1, 6 sections. Each section has guidelines that precede, that come before that section. So pathology and laboratory guidelines, and then you actually have the codes. Now, as a new user, I think it's beneficial for you to just review what's in each section from the perspective of the table of contents. So then, guys, after that, after those 6 sections of category 1, then we have our category 2 codes and our category 3 codes. Immediately following that, guys, a whole host of appendices. Appendix A all the way over to Appendix P. And then the last portion of the manual is the index. The index is actually where the coding process begins. Let's go over there now. So, before you actually get into the index itself, it is in your best interest to review the instructions for use of the CPT manual, because this really, lays the foundation for the different conventions and structure that you're going to see in the manual. So one area that I want to point out, which I think is very important, are the main terms that are used to locate a CPT code. What this essentially means is, as you dissect your procedure or service note, and the next step is for you to identify the CPT code, there are one of four possible ways to locate the code. And you, as the user of the manual, it's really trial and error that you learn which main term will actually work for a particular service. Nonetheless, there are four main classes of index terms in CPT. You can look up a procedure or service. You can look up a body part. Yes, and I know you guys are thinking, well, wait a minute. In other systems, you can't look up body parts. One thing you must understand, each system has its own set of rules and structure and format, and so you just have to embrace what that system has to offer. So yes, organ or anatomic site, you can look up the condition, or you can look up synonym, eponym, or abbreviation. So let's turn the page and look at the format. So the first thing that you'll notice, just like all of the rest of your coding manuals, the index is in alphabetical order. And in this particular case, the very first code is, or very first entry is a vitamin. Now, you notice that there is a note that says C vitamin A. So essentially what that means, guys, you won't find a code for a vitamin right here. And so what you'll need to do is just go over and see the word vitamin followed by A. So instead of being in the A's, you would go to the V's. So I also want you to notice that the main terms are in bold print. The main term is where you begin the process. So main term, for example, of abdomen has several options underneath it. You, as the coding specialist, are first dissecting your documentation to determine what procedure or service you're going to code today. And then, guys, you're going to come over to the index to then start to locate the procedure or service that you're going to be coding for today. So notice in the index, abdomen, abdominal aorta, or angiography, you get a single code. That means this code is the code that you want to go and look up in the main portion of the code manual. Now notice under abdomen, abdominal wall debridement, infected, you have two codes separated by a comma. What this means, guys, it's going to be this code or this code, and it's going to be based on what's documented in your health record. Now let's go down to, still at abdomen, abdominal wall, repair, hernia. Here, you got a whole lot of codes to consider. Again, guys, same concept. You look up each and every code option, and then you determine, based on your documentation, what the correct code is going to be. Okay? That's pretty much, guys, the format of the index. And let me just tell you, it is by trial and error that you learn how to use the manual. Okay, let me show you one more thing, guys, and then I'm going to wrap up my introduction to the CPT manual. I think one of the most complex parts of understanding the CPT manual is understanding the concept of a standalone code and an indented code. So first, let me set the stage and letting you know that standalone codes include the full description of a code. So for example, 51100 is aspiration of bladder by needle. Okay. Now, the indented codes, guys, are a part of aspiration of the bladder, but they are different ways that the aspiration of the bladder can be accomplished. Notice the symbol here, the semicolon. When you're reading an indented code, what you are going to do is go to the standalone code, read the description up to the semicolon, and then drop down and read the description for the code that you're looking at. So essentially, and guys, there is a company that has a great video on bubbling. I highly recommend that video and those services because it's an excellent way for you to organize your CPT manual. So I'm not gonna talk about bubbling because bubbling is definitely not something that I created, but it's something that I think is awesome. But I want you to notice, if the patient has aspiration of the bladder by needle, it's this code. If they have aspiration of the bladder by trocar or intracatheter, that's this code. If it's aspiration of the bladder with insertion of a suprapubic catheter, it's this code. So essentially what the AMA has done, instead of having to repeat aspiration of the bladder 3 times, it's listed once in the standalone code. The semicolon lets you know that that's the end of the description, and then you just drop down and read the description here, but you only are going to report that one code. Now, that's a pretty tricky concept, so let's look at a few more examples. All right, so let's see. Here we have repair of a large omphalocele or gastrochesis with or without prosthesis. And notice this is a standalone code and this is indented. So these two codes actually go together. And again, let me just emphasize, highly recommend that you watch the video on bubbling your CPT manual. Awesome resource. So here, this is a repair of a large omphalocele. This code is with or without prosthesis. This code here, which is indented, and notice it starts off with a lowercase level. This is removal of the large omphalocele with removal of prosthesis, final reduction, and closure in the operating room. So both of these procedures are the repair of the omphalocele. This one is with or without a prosthesis. This one is where you are actually removing the prosthesis. Oh, guys, 2 more things I want to show you, then we'll be done. Remember I told you that at the beginning of each section, you have what are known as subsection notes. And I mentioned that throughout the section itself, you would see additional notations. Here's one. This is known as a parenthetical note, which basically gives you some information about the codes that are above it. In this particular case, you are told, do not report modifier 63 in conjunction with this code or this code. That means you cannot report that modifier with either of those codes. Oh, look, guys, here is a reference to CPT Assistant. Remember, that's an additional reference outside of the manual. Here is an add-on code. And look, guys, more parenthetical notes. other notes that you're going to see in a section, these are known as subsection notes. So if you're utilizing this code family here, you want to be sure to read all the notes that pertain to this family. All right, guys, this has been Dr. Campbell's version of just a brief orientation to your CPT manual. I highly recommend that you spend some time reviewing the manual and getting familiar with it, because that will definitely help you use your manual. All right, guys, thank you so much and have a great day.